Welcome back. Well, today I am joined by Dr. Ashraf Ahmad, and he's here on behalf of Harvard Eye Associates. Well, welcome back. Nice to see you.
Thank you very much. Nice to see you too.
You're becoming a regular. We're just gonna call it the Dr. Ahmad segment.
I'm happy to be here.
Well, thank you. Well, we're talking about something that I think pretty much all of us suffer from one reason or another. I mean, it's either because of our super bloom, or maybe there's smoke or some sort of irritant that is out there in the air. And of course, this is dry eye.
Yes.
Now, why do they call it a syndrome? Is it because it does happen so often?
They call it a syndrome because there are so many symptoms that people experience, and some patients experience some symptoms, others experience other symptoms. So it's sort of the spectrum of symptoms that patients can experience.
Okay.
And so it's not one set value that's assigned to it.
Okay. All right. Perfect. Well, let's just talk about what it is.
Yes. So the reason why I wanted to talk about it today, as you mentioned, is the super bloom has been happening this year. And so anybody who has dry eye is going to have a flare-up of that. Anybody who has allergies is going to experience some sort of symptoms that are related to dry eye. And so when we think about dry eye, we really kind of think about two components. One is you're not producing enough tears, or two, your tears are evaporating too quickly. And most patients have a combination of those two. In my patient population, I estimate that it's about 1 out of every 3 to 1 out of every 4 patients that walks into my clinic has some sort of dry eye complaint.
Wow, and I imagine that's probably happening more and more now than maybe 10, 15 years ago.
Yes, and that's especially true because of all the screen time that we have with our cell phone usage and computers and tablets and things like that. But it's been very common even in the past as well.
Okay, all right, perfect. And then you mentioned that there are different kinds of symptoms. So what are some of the symptoms?
Yeah, so oftentimes patients will come in, they'll be saying, I have this foreign body sensation, this sandy, gritty feeling. I wake up with kind of this stringy discharge. Sometimes even patients will be like, I have a lot of tearing, and that's actually a sign of dry eye in some cases. And the fact is you're actually producing reflex tears in response to your dryness. And so it actually feels like you're producing too much tears, but it's reflex tearing, it's a cycle. And so you actually want to target the cycle at its core to prevent that cycle from happening.
Okay, and then sometimes though people, when you just described, you might have red eyes and you might have some sort of a discharge. Well, often I would think, oh my gosh, I have pink eye.
Pink eye or infection, and that's so true. Patients will come in scheduled for an infection visit with me, and it will actually be dry eye.
No kidding.
And one of the other telltale signs actually is having fluctuation in your vision throughout the day.
Okay.
And you may notice that blinking kind of improves that. That would be an indication that it's dry eye.
Okay, now you did actually talk about what causes dry eye is looking at our screens all the time, and we certainly go from a TV screen to a computer screen to our phone screens,
Yes.
So what else can cause?
So there's so many reasons to have dry eye, which is why in part it's challenging to treat. And some of the risk factors that you may have, females are more likely to have dry eye. Patients who have medical conditions like diabetes or autoimmune conditions like Sjogren's syndrome are more likely to experience dry eye. Being in a hotter or warmer climate like we are here in Southern California, absolutely more likely to have dry eye. If you've had prior refractive surgery like LASIK, you've had LASIK yourself. And so although that's temporary, it can still cause a flare-up in your dry eye symptoms. It's multifactorial, so many reasons to have it. Even lifestyle changes or lifestyle habits like not having enough omega-3 fatty acids can contribute to dry eye.
Well, and another thing I wanted to ask is that, you mentioned women are more prone to getting this. Is that because of hormonal changes?
Absolutely.
Okay.
Yeah, you got it.
Got it. So drink more water.
Hydration is key too. Yeah, absolutely.
Yeah, perfect. Okay, so our next slide here is treating dry eye, and there's just a multitude of ways.
There are so many things that are out there to treat dry eye, and for me, I kind of think about it as a tiered approach. So initially, I'll recommend preservative-free artificial tears, and I favor that more so than the regular or preserved tears because it's more friendly to the ocular surface, less risk of toxicity. And so I usually start that about 3 to 4 times a day for patients. Then we also think about eyelid hygiene. And so a lot of patients will have clogged oil glands.
Oh.
And when your oil glands are clogged, you're going to be missing the oil component to your tear films. And so your tears are going to evaporate much quicker. And so for that, we usually recommend doing warm compresses. And I like the use of a microwavable eye mask for that. The reason for that is it's nice. You put it in the microwave for 20 seconds. It will stay hot for 5 to 10 minutes. So it's hot for the full duration that you need it to be.
Okay.
Much more effective than kind of going back and forth with a washcloth.
Okay.
And so I recommend that once to twice a day just to soften those oil glands, get them secreting again.
So, but warm, not cold.
Correct. Yeah, warm compresses for dry eye. Cool compresses generally is more effective for allergy type symptoms. So if you have a lot of itching, then we kind of go the cool compress route.
And I want to go back to artificial tears. So what's the difference if, I mean, you can read the bottle and it'll say artificial tears, but what if somebody goes, well, you know what, I really like Visine or something like that.
Yes.
What's the difference?
Yeah, so anything that has get the red out, I tend to shy away from because it tends to be a little bit more toxic to the ocular surface, and two, you can actually get rebound redness when you discontinue it. And so the non-preserved or preservative-free drops, they come in individual vials that you use for the day, and then you toss it. So it's very convenient, less risk of contamination. It's very friendly to the ocular surface.
Okay. And then a couple of other treatments or things you can do is
Yeah,
lifestyle changes.
So correct. So yeah, once we sort of had the base figured out, I like to look at your lifestyle. We look at your dietary habits. If you don't get enough fish oil or omega-3 fatty acids, then we kind of incorporate that in there. Okay. You mentioned hydration being key. That's also really, really important. And then once we kind of establish that, and if you are still symptomatic, then we kind of look outside the box and start thinking about more prescription medications that are available. You might have seen some advertisements for cyclosporin or Restasis or Lifitegrast or Xiidra. Those are really good medications for long-term control of dry eye. They generally take a couple months for you to see the full benefit, but they are very effective treatment options. In the meantime, a lot of patients come to me already very symptomatic. So just to kind of get them feeling better, I'll often use a topical steroid drop so that they can feel better in the immediate phase. But that's not a good long-term solution. So those medications like Xiidra or Restasis are better alternatives.
Okay.
Another thing that I like to do when patients come in is consider punctal plugs. And so what that is actually in the inner corner right over here, you have a little opening where your tears naturally drain. And we can actually put a dissolvable collagen plug in there that basically serves to keep the tears lasting longer on the surface of the eye. And the nice thing is we do it in the clinic, so it doesn't require a trip to the operating room or anything like that. It takes me about 30 seconds to put them in.
Wow.
You don't see it, you don't feel it, and they last for 6 months. So it's really nice, especially for patients who kind of have a hard time remembering to use their drops. It's a really nice option.
Oh, that is wonderful. Now, another thing that you guys offer is something called an eyelid thermal heating device.
Yeah, so that's actually available widely on Amazon, or pharmacies will have it. It's very similar to the warm compress. Some of them you can actually plug into an outlet and charge. Okay. So it's nice if you're on the go, you have that option for you.
Oh, okay, okay. And then there's something that you can do in office, which is shown in the next slide.
Correct.
It just looks like little caps that go over your eyes.
Yeah, essentially, these are what we call like our spa-like treatments, and we do them in the clinic. And what happens is you come in, we hook you up to the machine. This one is actually LipiFlow. And what it does is it applies heat and then a gentle massage to your eyelids. Oh. And the purpose of that, again, is to soften your eyelid, your oil glands, get them secreting again. And I kind of think of this like going to your dentist, right? So you go to your dentist once or twice a year for your deep clean, but then you also have to maintain your toothbrushings at home.
Right.
And so this is similar to that in that you come into the office, we do this once or twice a year for you, and then you still need to maintain your warm compresses at home just to keep that going.
And this is generally for those that have severe dry eye.
This is more advanced, yeah. And I typically reserve this later on in the course of dry eye treatment because it's one of those things that's not covered by insurance.
I see.
So it's usually sort of one of those things that we look for later on.
Okay, well, perfect. So then overall, I mean, there's a lot of different things that you can do, but of course, first and foremost would be to recognize that you have dry eye, right?
Exactly. And so the key points from today is basically dry eye is a chronic condition. It ebbs and flows, so there's going to be times where you feel worse, like in a super bloom, times where you feel better. There's so many reasons to have it. It's multifactorial, which is one of the reasons why it can be challenging to treat. Every patient that comes in has an individualized treatment plan that's tailored to their needs. You know, we look at their lifestyle habits. We look at sort of what is going to be the most compliant with their situation. Sure. And then the key thing to note is it does require frequent visits with me just to make sure your ocular surface is not having any long-term damage, any corneal issues, so that way we minimize any damages like that.
Perfect. Well, thank you for the information. Good stuff.
Of course. My pleasure.
If you want more information about anything that we've discussed, you can always go to Harvard Eye's website, which is harvardeye.com, or you can call them for an appointment at 949-951-2020. We'll be right back.